Welcome back. According to the CDC, 15% of children ages 6 to 18 have some level of permanent hearing loss, which can lead to developmental delays.
Joining us live in studio to talk about what parents can do to help their child, please welcome Dr. Debbie Early from the State Department of Health. Dr. Early, thanks for joining us.
Thank you for having me.
Yeah, very important conversation. First off, for our viewers, is child hearing loss caused by genetics or the environment? How do you answer that?
Actually, both.
Okay.
It certainly can be genetics. Babies can, it can run in families. There are risk factors for late onset hearing loss, which is, today happens to be the last day for late onset hearing loss week. During May is Better Speech and Hearing Month. So some risk factors would be certainly significant prematurity, in utero infections like cytomegalovirus. Children can acquire meningitis. So these would be babies that would have passed the newborn hearing screening, but have these risk factors for late onset hearing loss that we want to monitor.
Is one more common than the other, a child being born with it or developing it later?
The CDC estimates that actually 15% of children between 6 and 18 can have some permanent hearing loss. In 2020, our data in Oklahoma showed that about 11% of babies that didn't pass the newborn hearing screening had permanent hearing loss that needed early identification and intervention. But actually, our research now shows that probably late onset hearing loss is more common, but we do track the newborn hearing screening for the CDC. However, the late onset hearing loss population are not necessarily tracked because it's not a mandate.
Okay. So what are some of the signs or symptoms to look out for? What are some things that say, I wonder if they're having trouble with hearing loss?
Concern for speech and language would be certainly one of the top ones. A child says, or what? A lot of ear infections, certainly that causes transient hearing loss, but we worry every bit as much about that as permanent hearing loss.
What is transient hearing loss?
Comes and goes.
Oh, okay.
Comes and goes.
If you're picking up on some of those signs, what should parents do and where can they go to find some help?
Certainly reach out to their doctor. Look for a pediatric audiologist in their area, and that can be found in many different ways. Eddie Pals is one website that families can go to. That's ehdipals.org. Certainly they can email our program at the State Department of Health at osdh.pediatricaudiology@health.ok.gov.
We're looking at the map and it shows a lot of resources available. So folks watching from home, if you think that you might want to get your child checked out, there is places to go and resources available.
So just a little bit about our program. In 2019, the State Department of Health launched a pediatric audiology program. When I came on board, we have 10 county health departments, pediatric audiology clinics across the state, mainly in rural Oklahoma. So it's early access, quick, close to home. No out-of-pocket expense to families. So it's families just make appointments. We don't need a referral or anything like that. So I believe we did provide the station with a map of where our pediatric audiology clinics are.
We just showed that. We'll have it at news9.com. Dr. Debbie Early, thank you for talking to us.
Well, thank you so much for having me. Thank you.